Okay, I just want to articulate some final thoughts that I had on healthcare. I know last time I went into great depth about problems that I perceived in our healthcare system today in the United States. But there were a couple things I left out, and there was one suggestion I had from a viewer that I wanted to address very briefly as well. But before I do that, I want to reiterate that whether or not you support Obama's healthcare plan, I think we can all agree that our healthcare system today in 2009 is sick, that it is a broken system, that it is in need of dire reform. Okay, we just disagree on the type of reform that the healthcare system needs. Now, the problem with Obama supporters is that they want to address the symptom of our sick healthcare system only. They don't want to address what caused that symptom, what caused the rise in the cost of healthcare, what caused the decline in accessibility in our healthcare system. They only want to address the symptom. The Obama supporter might make the argument, the cost of healthcare has gone up, accessibility has gone down. I think we need more government. I think we need the public option to save Americans from the problems that we have in healthcare. Well, it doesn't work that way. The problems that we are having in healthcare is a result of government. So we don't need more of it. We need to reject the methods that we've been using for the last half century, which has been constant government intervention. Now, I had one viewer say, okay, why didn't you talk about tort reform? And I agree that we need tort reform, but I didn't bring it up because it has gotten some coverage in the mainstream media, and so I wanted to talk about something new. And B, while I definitely agree that it has increased the cost of medicine, I don't believe that it is a fundamental problem in our healthcare system. The fundamental problem in our healthcare system is that we have no price competition, like I mentioned last time. So what I want to do right now, very briefly, is give you an analogy that I think may be easier for a few of you to understand, and try to draw a link between that and our healthcare system. But let's take the food industry, okay? We can all agree that food is an essential need. And we can all agree that there are some families in the United States who do not have an adequate supply of food in their house. So let's say that the government all of a sudden announced that we need food reform. And they announced that we were going to have programs like Foodacare or Foodicade or FMOs, food insurance that would cover your basic food needs. And you would go to the grocery store and you would give the cashier your food insurance card, and your food insurance would cover it. I mean, wouldn't that be amazing? Let's think about that a little more closely. What would happen to the price of food if all of a sudden if all of a sudden the consumer stopped buying their food with cash, stopped buying their food directly, and instead went through a food insurance company to purchase their food? The price of food would skyrocket because we all of a sudden would have a third-party payer. And if your food insurance company was going to cover the cost of your food no matter what, then why would you even shop around for the best prices? Why would you use coupons? Why would you go to a grocery store that had a sale on a certain item? It wouldn't matter because your food insurance company is going to cover it. There would be no price competition anymore. A loaf of bread could go as high as $15-20, and it wouldn't matter because your food insurance is going to cover it. Grocers would no longer have the incentive to minimize costs. Right now, in today's food industry, we have price competition. For example, if I'm shopping for groceries. Sometimes I'll go to Bi-Lo instead of Harris Teeter because Harris Teeter is a little more expensive. And by me taking my business elsewhere, I'm providing an incentive to Harris Teeter to lower their prices. But we don't have that in healthcare. We don't have price competition because our Medicare covers routine procedures. Our health insurance covers routine procedures. Am I advocating getting rid of all health insurance? No, of course not. We need health insurance, true insurance, to protect us in the event of some health catastrophe, a serious health problem that we couldn't pay for in cash. But we don't need our health insurance to pay for everything across the board. Why should I use health insurance to get a checkup at the doctor? I should be able to pay for that in cash. But state laws require that health insurance covers a very basic range of services, therefore eliminating price competition and instituting a third-party payer system that increase costs. Now, look at the one sector of the healthcare industry that has price competition, that has some resemblance of a free market, and that's cosmetic surgery or breast augmentation or laser eye surgery. Okay, in those industries, the consumer shops around. They find a doctor who offers the best quality service at the lowest price, and look what's happened. The cost of laser eye surgery within the last 10 years has fallen dramatically. And even though they're using high levels of technology, prices have still gone down dramatically. And that's because there's not much government intervention in those industries. In every other sector of healthcare, however, there is government intervention everywhere. There are third-party payers everywhere. So it's no coincidence that the price of procedures in cosmetic surgery and laser eye surgery have gone down in price over years, but the price of everything else in the healthcare industry has gone up. That's not a coincidence. There's a very good reason for that, and that's because we have government in those industries. Anyway, I hope that analogy made sense. Like I said, I'm not advocating getting rid of all health insurance. I just want the right. I want to have the ability to buy true insurance that only covers serious health problems and would reintroduce price competition in an industry in dire need of it. Anyway, those are my final thoughts, and hope you enjoyed this video, and I'll see you next time.